Hello everyone, and welcome. I'm excited to kick off today's presentation with episode 16. This is our very first slide, so I just want to say how glad I am to have you all here. Today, we'll be exploring some interesting topics, and I'll give you a quick preview of what's coming up. We'll cover the main themes, key insights, and practical takeaways. But for now, let's keep it short and get started. All right, let's take a look at this question. It asks, among these signs and symptoms, which one is most likely to be present in a client with mitral regurgitation? Now, mitral regurgitation is a condition where the mitral valve in the heart doesn't close properly, allowing blood to flow backward into the left atrium when the heart contracts. This can lead to various symptoms. Let's go through the options. First, altered level of consciousness. While serious, this is more common in advanced heart failure or other critical conditions, not typically an early sign of mitral regurgitation. Next, we have exceptional dyspnea. Dyspnea means difficulty breathing, and in mitral regurgitation, because of the backflow of blood, the lungs can become congested, leading to shortness of breath, especially during exertion or when lying down. This is a very common symptom in mitral regurgitation. The third option is increased creatine phosphokinase concentration. That's usually related to muscle damage, like in a heart attack or muscle injury, and isn't directly linked to mitral valve issues. Finally, chest pain. While some patients might experience chest discomfort, it's not the most characteristic symptom of mitral regurgitation. So, connecting this back to our overall understanding, the most likely sign here is exceptional dyspnea, because it directly relates to the hemodynamic changes caused by mitral regurgitation impacting the lungs. Recognizing this symptom is crucial for early detection and management. When it comes to breathlessness, or dyspnea, one of the key features we often see is when it's described as exceptional. By that, I mean situations where the patient experiences an unusually severe or intense feeling of shortness of breath. This isn't just mild discomfort. It can be quite distressing and may significantly impact their ability to perform daily activities. Recognizing this level of dyspnea is crucial because it often points us toward more serious underlying causes, such as acute respiratory failure, severe infections, or cardiac issues. Understanding the severity helps us prioritize our assessment and management strategies. Remember, the word exceptional highlights that this isn't your typical shortness of breath. It's a red flag that warrants prompt attention. Throughout the presentation, we'll see how this symptom fits into the bigger picture of respiratory and cardiovascular health, guiding us in making accurate diagnoses and delivering effective care. In mitral regurgitation, what happens is that blood actually flows backward from the left ventricle into the left atrium during systole. This backward flow has several important consequences. First, it leads to increased pressure in the left atrium, since it's receiving more blood than normal. This increased atrial pressure can then back up into the pulmonary veins, causing pulmonary congestion, which often results in symptoms like shortness of breath. Additionally, because some of the blood is leaking backward instead of going forward, the overall forward cardiac output is reduced. This means the body's tissues may not receive enough oxygen-rich blood, especially during exertion. So, understanding these effects helps us see how mitral regurgitation impacts heart function and can lead to symptoms like fatigue and pulmonary issues. So, when it comes to symptoms, the most common and likely one you'll encounter is dyspnea, or shortness of breath. This symptom tends to present in several specific situations. For example, many patients notice it during exertion, like when climbing stairs or exercising, because their heart and lungs are struggling to meet the increased demand for oxygen. Another key point is orthopnea, which is shortness of breath when lying flat. Patients often find it uncomfortable to lie down and may prefer to stay propped up to ease their breathing. And then there's paroxysmal nocturnal dyspnea, which refers to episodes of sudden breathlessness that awaken patients at night. This can be quite distressing, and it often prompts them to sit up or stand to catch their breath. Understanding these patterns helps us recognize the underlying issues, especially in conditions like heart failure, where fluid buildup and impaired cardiac function play a significant role. So, these symptoms are not just inconvenient, they're vital clues that guide our diagnosis and management. When we look at altered levels of consciousness, it's important to remember that this is not typically seen in mitral regurgitation unless the condition becomes quite severe. In cases of severe hypoxia or shock, then we might observe changes in consciousness, but otherwise, it's not a characteristic feature. Next, increased creatine phosphokinase, or CPK, is usually associated with myocardial injury. So, if we see elevated CPK levels, it hints more towards damage to the heart muscle itself, rather than problems like valve regurgitation. When it comes to chest pain, this symptom is more commonly linked to ischemic heart disease, which involves reduced blood flow to the heart muscle. Mitral regurgitation, on the other hand, doesn't usually cause chest pain unless there's concurrent ischemia. So why are these points important? They help us differentiate between different cardiac issues. For example, if a patient presents with chest pain and elevated CPK, we're likely thinking more about ischemic problems rather than valvular issues like mitral regurgitation. Understanding these distinctions allows us to better target our diagnostics and treatments, aligning with the overall goal of accurately identifying and managing cardiac conditions effectively. Let's talk about mitral valve disorders. When the mitral valve isn't functioning properly, it often leads to pulmonary congestion. This means you'll see symptoms like dyspnea, which is shortness of breath, fatigue, and sometimes a cough. These are important clues during your assessment. Here's a key exam tip. Pay close attention to these symptoms and correlate them with signs of pulmonary congestion. By recognizing these, you can narrow down your differential diagnosis more effectively. Remember, mitral valve issues tend to cause a backup of blood into the lungs, which explains the pulmonary symptoms. So always keep this connection in mind during your exams. It's a vital point that ties back to the overarching theme of understanding how valvular disorders impact the cardiovascular and respiratory systems. Recognizing these signs early can really make a difference in patient management.